Tell me about the pain. What does it feel like?
Well, right now it's been so bad this year, and recently, especially, it's burning. I get these stabbing pains in my hips, but I hurt all the time. It's just different degrees. Sometimes it's worse than others. And now I'm having this, for the last couple of months, I've been having this bad knee pain and hip pain at nighttime. And it goes down my thighs and my calves. And sometimes my big toe is numb. But it's stinging, tingling like when you're a kid and you stuck your hand too close to the plug or something, and you got that sizzly feeling.
Yeah.
That I have that a lot in my legs.
Is it both legs or just one?
The right leg's the worst now. And the funny thing about it, when I first injured my back, and for many years, it was just my left side. And I stumbled around, and my legs give way, and I've had some falls. Um, it's burning. It aches. It's numbness in places, just things like that.
Do you have pain down your legs with walking?
Yes.
And what do you do to relieve that pain?
Usually I have to lay down to relieve it.
And are you having any trouble controlling your bladder? Are you peeing normally?
No. And I've had that problem for a long time. I had the same pain management doctor for 25 years, and he retired. Since then, I've bounced around. And I talked to him about that several years ago, because I've been seeing different doctors now for about 5 years. And he said it was probably related to the back, because I went and got my bladder checked and all that female stuff.
And it
And
wasn't that. It was maybe the pinching of the nerves. Okay. And are you on medications now?
yeah,
What are
I
you
started
taking?
out on stuff. Now I'm taking Percocet 7.5s. Um, I take Robaxin, muscle relaxers, but I'm supposed to take them. They got them prescribed 3 times a day, but I don't take them that much because when you mix them with the other, they're maybe too loopy. And I take Lyrica, Cymbalta, and I don't take any anti-inflammatory because of the gastric bypass.
Right.
So
right.
I have a bad flare-up, though, which I went through a spell last month that it was so bad and I ran out of pain medicine. But I'm also doing medical marijuana, but I do the gel caps and the CBD oil, and I just use the vape because I never smoked. So I just use the vape whenever it's hurting so bad that I just need some relief, and I've had to use it more often this past month because it's just gotten so bad. But I'm waiting for an appointment with a surgeon, but I couldn't get in until July the 31st. So I'm just waiting.
Yeah. Well, I think that's the right thing to do. You do. Can I show you your MRI?
Mm-hmm. Sure.
You got a little bit of scoliosis, which is not uncommon, but if you look at your spine, this white area is the spinal canal. And see here, this thickened ligament narrows it. That's between your L4 and your L5. Between your L3 and your L4, this herniated disc and this thickened ligament narrow it a lot. And that is so narrowed down, it's something that is going to generally would require surgery. This is your L5S1. Here's your spinal canal and the way your nerve roots exit to the side. And then as we go up a little bit, here's your L4-5. Geez, that's narrowed. See this? This is your spinal canal. And here's your L3-4. And it's real narrow too. I think you're going to find that the surgeon will recommend a laminectomy at L3-4 and L4-5. They're also likely to get x-rays of you bending backward and forward to make sure there's no spinal instability. And in my opinion, you have been radically mismanaged by your pain management doctors. First of all, you were on heavy duty drugs and they didn't see you for a year. It wasn't clear who was.
And I've been on those heavy drugs for years.
Yeah, you got to get off those drugs. I mean, they're going to kill you. Everybody's dying. but you're also on a bunch of drugs that don't even make partial sense, like the gabapentin that you're on, the Cymbalta that you're on. This is just I get the impression they were like, who was that painter who would just throw the paint at the canvas? Remember
Yes.
that, that guy, and then he sold the paintings for millions of
Yeah.
dollars? That I feel like that guy was your doctor. They just
Uh,
threw drugs at you and oh, here's another drug. Oh, why do you have a spinal cord stimulator for spinal stenosis? I mean, these things don't make sense. And I don't know what was going on. And these narcotics, yeah, how many people do you know who have died from deaths of
oh, I know.
despair?
Yeah, I
Yes,
know.
ma'am.
It's
I don't
been
want
bad.
you to be I don't want you to be one of them. You got to get in to see the surgeon, get off all these pain meds and all these crazy drugs. Find a fire your pain management doctor and find one who's an addictionologist. Yeah, the
Yeah.
marijuana is a good idea and the CBD is a good idea, even better idea in my opinion. But
Mm,
the doctors who talk about getting you off these medications and then they prescribe them,
yeah.
no, that's a 1-2. If you're getting me off the medications, why are you prescribing them? Get me off. They don't ever get anybody off until they're dead. They get you off by coming to your funeral and weeping with your family. I mean, you're a caretaker. People depend on you. You're being mistreated and you got to stop it. Get some real doctors. I don't know what's going on in that town, but I don't agree with the way you're being treated, and I would really urge you to take a different route.